meeting. Thanks for coming. We did a motion to approve the previous meeting minutes. Motion by Gary, second by Joanne. All in favor? Any opposed? Number one, under previous business, authorizing an agreement with the Albany Medical Center Hospital regarding morgue and laboratory services. I understand number one and two are going to be tabled. Is that correct? By the executive?
They're not here. The coroners did call and said they wanted to table them for one more month.
Okay. Do we need a motion if not here to table it, or are they tabling it?
You can make, well, they don't have the right to table it. The
Okay.
committee would have to make a motion.
Motion.
Motion by Gary,
Second.
second by Sam. All in favor? Any opposed? Under current business, number three, authorizing an agreement with the Research Foundation for SUNY regarding a public health live webinar for Ebola and Zika preparedness and response efforts. Commissioner Allen?
Good evening. We have two today. This is our first one, and this is requesting authorization to enter into a contract with the Research Foundation for SUNY using funds that we were previously received through a Public Health and Emergency Preparedness Grant to have them conduct and produce a public health live webinar for healthcare providers, which would give them information on emerging infectious diseases such as Ebola virus and Zika.
Any questions from the committee?
Yeah, I do. In the paperwork, the duration of the contract, August 1st, 2016 through October 31st, 2016. We've already, we're into August now, so are they doing anything now, or what's the explanation, I guess?
Yeah, we're in the process of, we've been in the process of working with them, and they're in good faith working on a product, but as they know, we need legislative approval, so we can't go forward until we get your approval to do so.
Okay, so obviously this is something that should have been approved prior to August 1.
Not necessarily approved prior. We won't go forward with this unless the legislature gives us approval to do so.
All right, so they're helping you out, but they're, if it gets approved, then we'll get paid for the,
Exactly.
from the work from August 1st?
Right.
Okay.
Kind of similar to like when we had the human services evaluation that's currently going on, we had entered into conversations with SUNY Human Services Research before that, but nothing could actually move forward from a financial perspective unless we had approval from the legislature.
Okay.
SUNY knows our process. If there's no approval, we're not on the hook.
Okay.
Motion voted.
Motion by Gary. Any other questions? Do you have a second?
Second.
Second by Joanne. All in favor? Any opposed? Unanimous. Number four, authorizing an agreement with the Home Aid Service of Eastern New York, doing business as the Eddy Visiting Nurse Association regarding maternal child health patient services.
And this is to extend the term of a previous 5-year contract in order to give us time to facilitate a negotiation for a longer term contract between September, the current contract ends September 26th, and the amendment will resent it to end December 31st. And this is to provide services that our maternal child nurses are performing, to go out and do home assessments and clinical evaluations in the home. And we need to contract with them because the payment comes through them. It's the mechanism for payment.
Any questions from the committee? Joanne?
So this isn't a Medicaid service? I see it's 100% county, so it must be just a public health initiative, not for the Medicaid population now?
No, this is for the Medicaid population. So basically, we are a licensed agency, and Eddy Visiting Nurses is a certified home health agency, so they can bill directly to Medicaid.
Okay.
LICSAs or licensed agencies cannot, so we are subcontract to them. We do the work, they bill, and then they provide us with payment for it. It used to be that we were a certified agency, and we decertified a number of years ago. So this is an opportunity to receive payment for much of the public health work we do, the maternal and child health work.
Okay, so is the licensed agency that the county operates, is that what Home Aid Service of Eastern New York is?
No, Home Aid Services is, I believe, the name of
Through the Eddy.
Eddy, right.
So that's the name of their licensed agency?
They're certified home health agency.
Okay,
We're licensed, they're certified, two different distinctions.
right. Okay, I don't think that's they're one of my members, I don't think they're licensed, I don't think that's the name of their certified agency, Homemade of Eastern New York.
I'm not exactly sure. That's the contract language they sent to us.
Okay.
But we can certainly go back and check it.
Okay.
They are through St. Peter's Partners, I'm sure you're
Right,
familiar,
yep.
right? So,
Right,
but we
Okay.
can certainly check and see if for some reason that's been entered incorrectly.
so I didn't realize the county still operates a licensed agency, so when.
We
the co-
have to, yeah, to do our public health work.
Okay,
all
so when you got
counties.
rid of your certified agency, you kept the license?
We established a licensed
Okay.
agency, right, we were always, we were only a certified agency, and then we established a licensed agency when we divested of our child services.
Okay, thanks.
I missed that last part. Is there any benefit for us to recertify or?
To become a certified home health agency. We chose not to do that because of the regulatory requirements of it, and it's really being handled by other entities in the county, and the local health departments are doing more public health work, and to do that, you have to be a licensed entity. We took advantage of subcontracting with Eddie because we do so much maternal and child health work that we can maximize our reimbursement through having that subcontract. Otherwise, we would be doing it for just Article 6 state aid funding, which is 36%. Here, we get actual fee for each visit on top of 36% state aid for that.
Thanks. Any other questions from the committee? Okay, have a motion move.
So moved.
Motion by Joanne, second by Brian. All in favor? Any
Aye.
opposed? Thank you.
Thank
Motion
you.
adjourned.
Heard of it.